Welcome to N News.
We will talk about lymphoma today.
Let's start it.
You know, we rely on our immune system every single day to be our personal bodyguard, right? It's our defense force. But imagine if those very defenders, those soldiers, suddenly went rogue. That's kind of what happens with lymphoma. The key players, these white blood cells called lymphocytes, they just start growing completely out of control. The very system designed to protect you becomes the source of the problem.
What exactly is lymphoma? At its heart, lymphoma is a cancer of the immune system. It gets its start in these cells called lymphocytes. You can think of them as the security guards for your body. Their whole job is to fight off infections. But with lymphoma, these cells start growing and multiplying like crazy, completely out of control. And because these security guards are everywhere, in your lymph nodes, your spleen, your bone marrow, lymphoma can pop up almost anywhere in the body.
So, just to give you a sense of scale, lymphoma makes up about 5% of all cancers out there. Now, you might hear more about cancers like lung or breast cancer, and that's fair, but lymphoma is actually the 6th most common cancer overall. That means it affects a whole lot of people.
Lymphoma isn't just one single thing, it's more of an umbrella term. To really get it, you have to know that it's broken down into different types and stages. And this isn't just for, academic purposes, it is absolutely crucial for figuring out the best way to treat it.
So the first big fork in the road is between Hodgkin lymphoma and non-Hodgkin lymphoma. And honestly, the difference all boils down to one very specific weird-looking cell. It's called the Reed-Sternberg cell. It's pretty simple, actually. When doctors look at a biopsy under a microscope, if they see that cell, boom, it's Hodgkin lymphoma. If they don't see it, then it gets classified as non-Hodgkin lymphoma. And that second category is way more common. We're talking 90% of all cases, and it's a huge family with over 70 different subtypes.
A lot of the time, the first thing someone notices is a swollen lymph node. It's usually a lump in the neck, an armpit, or the groin area, and the key thing is that it's painless and it just sticks around. It doesn't go away. On top of that, people might feel this bone-deep tiredness, a kind of fatigue that no amount of sleep seems to fix, or maybe a cough that won't quit, or even just really, really itchy skin for no obvious reason.
Now there's a specific group of symptoms that doctors take very seriously. They're called B symptoms, and they're major red flags. We're talking about high fevers that come and go, drenching night sweats, like soaking through your pajamas kind of sweats, and losing a noticeable amount of weight without even trying. When these show up, it can mean the disease is more aggressive, and that definitely shapes the treatment plan.
Never, ever be afraid to ask questions. Seriously, it's one of the most powerful things you can do. It's a great idea to write your questions down before appointments so you don't forget anything. And maybe bring a friend or family member along to take notes. Remember, your team is there to help you understand everything. The path to a diagnosis usually follows these exact steps. It's going to start with a physical exam and just talking through your health history. But the step that is absolutely 100% critical is the tissue biopsy. They have to get an actual piece of that tissue to look at under a microscope. After that, imaging, like a PEG scan, shows where the lymphoma is hiding in the body. All that info gets put together to determine the stage, which is crucial for planning out the best treatment.
This is the absolute gold standard for diagnosis. It's a procedure where a surgeon takes a small piece of tissue, usually from a swollen lymph node, and sends it off to a lab so a specialist can get a close look.
And here's how that actually happens. A surgeon removes that tissue sample, and you'll see here that an excisional biopsy, where they take out the whole lymph node, is what they prefer. Why? Because it just gives the pathologist more material to work with, which helps them be more accurate. Then that sample goes to the lab, where the experts hunt for specific markers, like proteins and DNA changes that don't just confirm it's lymphoma, but also tell them the exact type.
Next up, your team will almost certainly use a PET CT scan. This is a really powerful imaging tool. It basically combines two scans into one to create a detailed map of your body. It works by tracking a special kind of sugar that cancer cells love to gobble up. So anywhere that sugar lights up, that's where the lymphoma is active. This is totally essential for what's called staging, figuring out how far the cancer has spread, and that info is key for picking the right treatment. All right, another big question is whether the lymphoma has gotten into the bone marrow. That's the spongy stuff inside your bones where all your blood cells are made. To figure that out, doctors do this two-part test to get a direct look inside.
What's pretty amazing here is how they do this. It's two procedures, but it's all done through one single entry point in the back of your hip. First, they do an aspiration, where they draw out some of the liquid part of the marrow. Then, through the same spot, they do the biopsy, where they take a tiny, solid core of the tissue. Sending both of those samples to the lab gives them the full story on your bone marrow's health.
And in some situations, a lumbar puncture, or what most people call a spinal tap, might be needed. This is usually done if there is any concern that lymphoma could be in the central nervous system. That's your brain and spinal cord. They just take a tiny sample of fluid from your lower back to check it for any cancer cells. This might sound a little strange at first. For some lymphomas that are growing really slowly and aren't causing any symptoms, the best first step is to do nothing. Well, not nothing. It's called active surveillance, which means watching it very, very closely. And this chart really lays it out perfectly. You've got two totally different paths, and the choice is all about the cancer's behavior. If it's just kind of sitting there, not causing trouble, you watch and wait. But the second it starts causing symptoms or growing quickly, bam, it's time for active treatment.
Okay, so once they know the type, the next question is, how far has it spread? Doctors use something called the Ann Arbor staging system for this. Think of your diaphragm, that muscle under your lungs, as a dividing line. Stage 1 is simple. The cancer's in just one spot. Stage 2, it's in a few spots, but they're all on the same side of that dividing line, either all above or all below. Stage 3 is when it's crossed over. You've got it on both sides of the diaphragm. And then stage 4, well, that's when it has spread beyond the lymph nodes into other organs like the liver or lungs.
There's no one-size-fits-all cure here. It's about picking the exact right tool for the exact right job. So let's take a look at the most common tools in that kit. This gives you a great bird's eye view. You've got chemotherapy, which is systemic. It goes everywhere, perfect for lymphoma that's spread widespread. Then there's radiation, which is like a laser-focused beam for a specific area. And then you have targeted therapy, which is the really smart precision approach. Chemotherapy has been a cornerstone of cancer treatment for a long time. Basically, it's designed to kill any cell that's dividing quickly. Now, since that's what cancer cells do best, it's really effective. The downside is it can also hit some of your healthy, fast-growing cells too, and that's what causes the side effects. Now, radiation is kind of the opposite of chemo. It's not about treating the whole body. Think of it like a sniper. It uses these high-energy beams to zero in on a very specific spot, which makes it a fantastic option when the lymphoma is just in one or a few places.
Now, this is where treatment gets really smart. Think of targeted therapy as less like a carpet bomb and more like a laser-guided missile. Instead of hitting all fast-growing cells, these drugs are designed to find and attack very specific weak spots that are unique to the cancer cells themselves. That kind of precision often means fewer side effects for your healthy cells.
But wait, there's more. Beyond those main three, the toolkit has some even more specialized options. Immunotherapy basically supercharges your own immune system to do the fighting. CAR T-cell therapy is this game-changing treatment where they literally re-engineer your own cells to hunt down cancer. And stem cell transplants can be used to give you a whole new healthy bone marrow. These are powerful tools, often used in very specific cases. Yeah, treatment can be tough, no doubt about it, both physically and emotionally. Each treatment has its own possible side effects. With chemo, for example, you might deal with nausea and fatigue. With radiation, maybe some skin irritation. But the main thing to remember is you're not on your own with this. Your healthcare team is there to help you manage everything, every step of the way. And here's something really cool. There are things you can do to get ready before treatment even starts. It's called prehabilitation. Think of it like training for a big event. By focusing on exercise to get stronger, nutrition to fuel your body, and getting mentally prepared, you can build up your resilience. It can make a huge difference in how well you handle treatment and how quickly you recover. So what happens if there's a relapse after that first round of treatment? Now, this is really important because it kind of flips a common assumption on its head. A relapse doesn't automatically mean you jump back into intense treatment. Sounds familiar, right? Just like with the initial diagnosis, if the cancer is back but it's slow growing and not causing problems, the first step is often to go back to watching it closely. And that just reinforces the key takeaway here. There's no single playbook for how to handle a relapse. It's got to be completely personalized. It means sitting down with your entire medical team, reevaluating everything, and figuring out the absolute best path forward for you. So the toolkit gets opened all over again. The team might need to do new scans to see exactly what they're dealing with. Maybe they'll try a totally different kind of systemic therapy. Or if the relapse is just in one spot, they could use radiation. And there's always the option of a clinical trial, which can give you access to cutting-edge treatments. Now, this is such a critical point for anyone dealing with that anxiety after treatment. You might think, well, the safest thing to do is just get scanned all the time, right? but experts actually advise against that. Routine surveillance scans haven't actually been shown to help people live longer, and they can cause a lot of unnecessary stress and radiation exposure. The thinking is pretty clear now. Scans should only be used when there's a specific symptom or a real concern that needs to be checked out.
It's so important to talk about the long-term outlook, how you can take care of yourself, and just what life is like after the fight.
Let's talk about the numbers, because honestly, they should give us a lot of hope. The 5-year survival rate for Hodgkin lymphoma is up around 89%. For non-Hodgkin, it's about 74%. Those are really encouraging statistics, and they're a direct result of how much better treatments have gotten. It shows just how much progress has been made.
Finishing your last treatment, that is a day for celebration, no doubt about it. But it's not quite the finish line. It's more like the start of a whole new phase, the phase of living in remission and keeping an eye on your long-term health.
So what does life in remission look like? Well, it's really a partnership with your doctors. It means going to your regular follow-up appointments. Those are non-negotiable. They're there to watch for any signs that the cancer might be coming back. It's also about keeping an eye out for any long-term side effects from the treatment you had, and just generally being on top of your health for the rest of your life. Simple things can make a world of difference. Eating well gives your body the fuel it needs. Getting even a little bit of gentle exercise, like a short walk, can be a game changer for fighting that fatigue. Finding ways to manage stress, maybe meditation, maybe deep breathing, that's huge. And because your immune system is taking a hit, just being super careful about infections and calling your doctor right away if you get a fever is absolutely vital.
Life after treatment is really all about staying healthy and being proactive. And this isn't just a random list. Every single item here has a specific purpose. Regular exams and blood tests help keep an eye out for any signs of recurrence. But it's also about managing any long-term effects from the treatment itself, like if you had radiation to your neck, you'll need your thyroid checked. And even simple things like getting your flu shot every year are extra important to protect an immune system that's still recovering.
This quote from the Mayo Clinic really says it all. Your support system, your friends, your family, they are a hugely powerful and totally essential part of your care team. They're there for the practical stuff and for the emotional strength you'll need to get through it.
And your support system can have a lot of different pillars. Of course, there's your healthcare team and your friends and family, but don't forget about counselors, social workers, and formal support groups. There are amazing organizations out there, and even online communities where you can connect with people who just get it.